Welcome back to Ask Dr. Mingle. It's great to see you again. I'm Dr. Dan Mingle. I'm a family physician, founder and CEO of Mingle Health. I'm here to answer your questions about value-based care and value-based payment. Let's dig in. Today's topic is the 2026 final rule for Medicare's physician fee schedule, which includes those things that I'm interested in, and I'm presenting to you about the quality payment program, Medicare shared savings program, the merit-based incentive payment system, and alternative payment models. This is the third in a series of 6 presentations to break it up into bite-sized pieces of interest to you, so you don't need to wade through a lot of dry things that you don't need. This final rule was released on October 31st of 2025. Some of the rules go into place retroactively for the 2025 performance year. Most go into effect January 1st, 2026. At the time of this presentation, we're weighting the final scoring on the 2024 performance year, which was the 8th year of the QPP program. This rule is about 2026, which is about the 10th year of the quality payment program. Regarding alternative payment models, 528,000 clinicians achieved QP status, that's qualified participant status, for 2024, and 2,000 clinicians achieved partial QP status. The count of MIPS APM participants is not yet publicly available. The key thresholds for 2026 start with the performance threshold, which is steady at 75, set in rules now through the 2028 performance year. And the data completeness threshold, likewise, is 75%, set in the rules through the 2028 performance year as well. There's no telling at this point whether either of those will go up after the 2028 performance year, and they can go up earlier or even down, subject to change in any annual rulemaking cycle. Pertinent to MIPS alternative payment models, that's MIPS APMs, the MIPS category weights remain at 50% for quality, 0% for cost. Cost is factored into the payments methodology for all alternative payment models, so they don't separately score cost in those MIPS scores for MIPS APM participants. 30% of the score comes from promoting interoperability and 20% from improvement activities. And of course, for all alternative payment models at this point, participating in the model confers 100% of the points available for improvement activities. And of course, the category weights are subject to special reasons for reweighting those categories. There are special statuses and practices that lead to reweighting. There's extreme and uncontrollable circumstances, either conferred automatically for widespread events or per application if something's particularly affected you and you apply for an EUC exception. APM entities who have MIPS participants, now not all do, if you're an advanced alternative payment model, that is two-sided risk, and you're a qualified participant in that model, you're exempt from MIPS. If you're a partial QP, you can choose to be in MIPS, or if you don't achieve partial QP or full QP status, then you have a MIPS liability in that year of participation in an APM entity. MIPS APM participants can submit MIPS individually or as a tax ID number practice group or as an APM entity. The APM entity can submit quality measures and the whole MIPS submission on behalf of its members, and can use any of the available submission methods, including traditional MIPS, MIPS value pathways, or the APM performance pathway. Now, multiple submissions are accepted for any particular provider or group, and the provider will be credited with the best submitted score. The major exception to those rules is MSSP, that's Medicare shared savings program participants are required to submit the APP plus measure set to be eligible to collect their shared savings. In the rules for advanced APMs is a refinement of the QP, that is the qualified participant status check. They're continuing to check QP status annually from at the APM entity level, and they're also simultaneously checking individuals for their own QP status, and they're adding a new calculation from both perspectives. They'll not only count the percent of patients that are participating in the ACO that are attributed to the ACO, but calculating percent of charges from the perspective of just E&M codes or the perspective of all covered services. Each individual participant will be granted QP status or partial QP status if achieved by any calculation method at any of the 3 snapshot periods that are done before the submission period starts. There is a change coming in 2027 performance year, now set in the rules that thresholds for achieving qualified participant and partially qualified participant status go from 50% to 75% on the payment amount, from 35 to 50% on the patient count. For the partial QP thresholds, that goes from 40 to 50% in the payment amount, or 25 to 35% on patient count. The same changes are reflected in the all payer models. They go from 50 to 75% on payment amount, or 35 up to 50% on patient count. Those numbers also mirroring in the partial QP threshold at 40 and 50 for patient payment amount, and 25 to 35 on patient count. For all years, there's a minimum Medicare portion to qualify to be a QP or a partial QP in an all-payer model. That stays stable at 25% on payment amount for QP status, 20% for patient count for that QP status, 20 and 10 for the respective statuses in the all-payer model. If you expect to be part of a medical home model in future years, starting with the 2027 performance year, medical home models are no longer limited to parent organization of no more than 50 providers. Now there's no limit to the size organization that can participate in those medical home models. And finally, this new rule adjusts the targeted review timelines for participants in alternative payment models to be the same timeline that MIPS participants enjoy for targeted reviews. That's all I have for you in this session. Watch for my other sessions regarding this set of final rules. Look forward to seeing you again at the next session. Don't forget to ask your questions, correct my answers, contribute your comments. We are smarter together.